Good morning, everyone, or afternoon or evening, whenever you're listening to this. I'm Lisa Wessell from Encompass Women's Health, or nurse practitioner. Like us, join, subscribe, all the above. Send comments because that would be amazing. Today, we are going to talk about non-hormonal options of hormone replacement therapy. So I guess it wouldn't be hormone replacement therapy. Different things that you can do if you don't want to do HRT, or you don't want to use estrogen, you don't want to use progesterone, you're not interested in testosterone, whether that's for whatever reason. You don't have to justify that to anyone. You could just be like, that's not what I'm interested in. Or maybe I have concerns about the risks of hormone replacement therapy. Maybe I was diagnosed with breast cancer and I'm scared shitless to do that. There are options out there, and I think it's important to address those. I like to start by saying that there are very few indications for women to not be a candidate for hormone replacement therapy, whether it's the progesterone, estrogen, testosterone. Some of them are just, it's like actively, like if you are actively treating cancer, then that would be a no-go. And part of it is we don't know. Some of it is fear on your provider side. Can we do this? Should you be on this? And if we've been diagnosed with cancer, and depending on what type of cancer, people are very, very hesitant to use hormone replacement therapy.
I I need to interrupt with a question.
Yeah.
What about conflicting information? Because if a patient comes to you and gets this information that you are very confident
Yeah.
about HRT, you know the statistics, and then they have a friend of a friend that is an oncologist or works in that silo
Mhm.
of healthcare, and they're saying, absolutely not. HRT causes cancer. Now the patient is in this like, well,
Yeah.
wait a minute. I have my nurse practitioner, but now I have an oncologist who actually
Right.
works with cancer.
Yeah. Yeah,
How
and
do you
I will tell you from my experience of like my own, me, there are times where you're just like, there is that piece. You're like, I'm just a nurse practitioner and you're talking to a doctor. Like, so there's this whole dynamic, and you don't want to tread on someone else. Like, we all do know our things, and there is a time and a place. And cancer is awful. Like, I would say, I would like literally have to knock on because my wall's over there. Because like no one wants cancer. Like no one
No.
wants that diagnosis. I've never been diagnosed with cancer of any kind, so that would scare the shit out of anyone. You can't take it lightheartedly. Kind of comes down to is let's say you had cancer, and I'm specifically talking about breast cancer. Give them the information. You give them the literature, and allow them to and are open to answering questions. The benefits of hormone replacement therapy typically outweigh any of the risks for most women, and it's a decision. So like you can't ever tell someone that you're never going to get breast cancer.
Right.
You're never going to have a stroke, and you're never going to have dementia. You're never going to break a hip. That's just crazy talk. But I can show you the research and I can tell you the benefits. One of the problems is when we only look at women's breast as the sole everything of this person in front of you, then we're missing a ton. And when we
Mhm.
only are concerned about one piece or part of them, then we're missing a whole thing. And I think we've talked about this. Like more women die of cardiovascular disease yearly than breast cancer.
Right.
And, we know that Alzheimer's disease is prevalent in women more than men. What an awful disease. And
Yes.
we know that if you break a hip, like you're dead in a year.
Yes.
For the
Yes.
most part, like keep it pretty simple. What are options? What are things
Yes.
that we could do? Now, obviously, I'm a big proponent of hormone replacement therapy and the benefits that we get with all of that, but there's other options out there. We were just looking at our supplements and things like black cohosh, and black cohosh is the first one I kind of think of. But you can, if you're looking at a supplements, um, and for a lot of them, they help, they work. Now, is there a placebo effect involved? Yeah, there is. Does it matter? When we're talking about like non-hormonal HRT, the thing that people need to remember is you're not like the benefits of hormone replacement therapy are not happening with those. We are treating the symptoms. And
Right.
most of the things on the market. So if we put aside supplements, and again, you're treating hot flashes, you're treating night sweats. It's likely not going to happen with your mental clarity or your brain fog or not being able to find words. It's not going to protect your bones. It's not going to protect your heart. It's not going to protect your brain. We're treating the symptom of the vasomotor symptoms of menopause. That's it. That's all we're doing. There's a lot of stuff that is coming on the market more and more. We know that low dose Paxil can reduce hot flashes.
What is Paxil?
It's an SSRI. It's an antidepressant
Okay.
that we use. So typically, the normal dose of 10 milligrams is where you start with Paxil for depression. But for hot flashes, it's like 7.5. So this happens often when we find a off-label use of a medication. Like, hey, we've noticed that people on Paxil are having hot flashes. Like, let's look into that. It gets repackaged. There's a lot of antidepressants that can be helpful in the reduction of night sweats and hot flashes is what they found. And you also have the side effects of those, right? It's like nothing is without nothing. You can fix one thing, you can break another.
Right.
I'm not having hot flashes and nights, but now I have no libido. I'm having some gastrointestinal, whatever the side effects are of them. Then there's what we call SERMs, selective estrogen receptor modulators, where those are blocking one receptor of estrogen and allowing the other receptor to work. Is it an estrogen per se? No, but those work specifically on, again, the receptors. So we have alpha receptors in our body of estrogen. We have beta receptors of estrogen in our body everywhere. How SERMs work is this: beta receptors are, I call them ADD receptors. Like they're like, oh yeah, that's fine. Like if you think of like type A and type B, like type A is like you look like estrogen, but I know you're not. So you're not. And yeah, exactly. And B receptors are like, okay, sure, come on. Like, and so what SERMs do is they turn on the B receptors and they turn
Okay.
off the A receptors. And we have a lot of A receptors in our breast, and so those ones don't get turned on. We have a lot of B receptors, in the vagina. Those get turned on. So like vaginal dryness. You can, and there's different types of SERMs, but like that's how those work. But does that mean that nothing's going to happen either? Like no, there's side effects there as well too. So like there's other things that we could consider doing. I was telling Diane I had to look it up. Viora, Veozah. How do you think you say that correctly? This is a non-hormonal form, which works on like more of your interleukin, which is in your hypothalamus, heat regulatory thing. I don't know enough about it to really give you much information, but it's kind of funny that we chose this topic, and maybe we chose it because this was sitting on my desk. But decrease in vasomotor symptoms. Number one, if you're told no, like if you're interested in hormone replacement therapy and your provider tells you no, the next question is why.
Mhm.
And so I think as a consumer, why? Explain to me or help me understand why would I not be? There's a lot of rules that have been put in place when it comes to hormone replacement therapy, like, oh, it's been 10 years, you can't do that. Like that's not necessarily an answer. That's a different discussion. Like, oh, there is a difference if I'm postmenopausal. But does it mean no? No. It means we're taking on a different risk, and we're having a different conversation. I just spoke to a woman yesterday who's 65 and still having hot flashes and not sleeping. And it's been 10 years and we're, going to do this whole workup, but you're just like, it's just a different discussion. This is my concern. This is why, and this is where it's coming from. What would you like to do? There is a part of informed consent that is the positive and the negative in making that decision together. And a lot of times, if you're informed of the risks, it helps.
For so long, there have been gatekeepers to women's health,
Mhm.
or it just hasn't been studied. There's so many factors behind the scenes.
Yeah.
We haven't had a lot of autonomy over our own bodies forever.
Forever.
And now science is coming out. Practitioners like yourself are saying, let's
Yeah.
talk about the risks. Let's be informed. Let's have all the information and have a discussion and a dialogue instead of a monologue based off information that is no longer accurate.
Mhm.
Or I think anytime something is new, it's a little scary. And this is still a relatively new conversation, even though we've been talking about it for quite some
Yeah.
time.
Yeah.
In the whole, it's like marrying for love. I mean, it's just a relatively new thing that we're still trying to figure out. Having the conversation make sense. It's the comfort level, and knowledge is power. And you have the ability to look up the knowledge as a patient, and you can challenge your provider if they say no. And challenge may sound like you're going to duel or something, but more of like a spirited conversation, and you
Yeah.
can advocate for yourself.
Right. Right. I hear it often, and I really, you have to appreciate providers when a provider says to you, I don't know, or
Mhm.
I'm not comfortable with that. I'm not the person to take care of that for you. That person is like worth their weight in gold to me because
Yes.
we're so afraid to not know or not have the answer. People ask me all the time, "What do you think about this supplement?" I'm like, "I don't know. I have no idea. Send it to me. I'll look at it. There's certain things I'm looking for, but I don't know all the supplements out there. I don't know all the companies out there. Medications, do you know how many freaking medications there are on the market now? Like I'm going to have to look that up. Um, we providers don't know everything. We have a fairly strong knowledge base, the ability to like look at research, the ability to find the right research. But in this day and age where we are with the internet and all that information out there, yeah, there's a lot of information out there. And I think as a provider, you have to be willing to like, again, have those discussions of, yeah, and the answer could be like, yeah, I'm not comfortable doing that too.
Mhm.
So the point of this talk is that yes, there are different options out there. You can use different over the counter things for vaginal dryness. There is a lot out there that can be extremely beneficial. Keeping in mind you're not like going like behind the back door and like taking care of why, but you can fix the problem. And you're not getting
The symptom, not the root.
right, exactly. So that's what you're doing. So we can fix vaginal dryness, we can fix painful intercourse. Is it going to reduce the likelihood of urinary tract infections? Probably not because we don't have the estrogen there, we don't have the testosterone there. As far as symptomology, yes, we can stop hot flashes, we can stop night sweats. Is it going to protect your brain fog, word fog, same thing. Um, is it gonna help with that? No. Is it gonna protect your bones, your heart? No, but like we can take care of the symptomology. Like I don't want women who aren't using HRT thinking like, oh my God, I'm gonna lose my brain. I'm gonna have Alzheimer's. That's not that doesn't mean that's what's gonna happen. I can look at my mother who's 80 years old who's never used hormone replacement therapy because she grew up in that time. And she's doing pretty well.
Mhm.
She's not broken a bone, cognitively still healthy. So there's other things like lifestyle. There's other things you can do. So it's not like, oh my gosh, I'm destined, I'm going to die. Like, no, well, I mean, we all are going to, but, we can still have very nice, healthy, happy lives without doing a therapy.
Right. There's no shaming. It's important to know that there are other options if you
Yeah.
choose not to go down the HRT route.
Right. Right. Absolutely. That's it for today on that topic.